Okay, we're recording.
I'd like to go ahead and call the meeting to order at 6:03. Dr. Kingsley just called in. He has a complex delivery he is attending, but will join us when he's available. We do have a quorum. I'd like to go through the roll call. Zach?
Here.
Michael's here.
Kim's here.
So we do have a quorum. Let's go ahead and proceed with the Pledge of Allegiance. I pledge allegiance to the flag
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
He must be halfway around the world. Council? Susan, I would like the record
I'm
to
finally
reflect
here.
that following the roll call and the pledge, Susan joined, and so we now have 4. Susan Kingsley got called away for complex delivery like a minute before 6, so he will join us when he can. I thought we'd just plow through this, if that's okay with everybody.
All right with me. That's
Do we
great.
have Go ahead.
I was just gonna say, I'm sorry I'm a little late. I forgot we're 2 hours behind you now.
Well, I'm glad you weren't chiming in an hour later.
There you go. Could have been.
I don't see any public guests, so we will move on to review the April past minutes. Anyone wish to have any discussion about the February 19th board minutes? Hearing no discussion, I would entertain a motion to approve the minutes.
Motion to approve the minutes?
I'll second. Roll call vote. Zach?
Yes.
Michael, yes.
Kim, yes.
Susan?
Yes.
And it passes. I don't see anything under old business. Does anyone have anything on old business? Hearing none, we'll move on to the next items. Reports, subcommittee reports, director report.
So Taylor, if you can just kind of scroll as I go, scroll down just a little bit more. Thank you. So here's the vital records, and I won't, I'll let the numbers speak for themselves. As you can see, numbers are continuing to look good. Again, like I mentioned last month, some of the highest numbers we've had since we've moved into the new building. Go ahead and scroll to the next page. You can keep going. One thing I want to mention is Cheyenne Brunkow, who is our health educator, one of our new staff. She's a health educator working under Trisha Rothweiler and Taylor. Her and I volunteered at the Katie Scott Blood Drive in Overland Park, Kansas in February. We were supposed to have our first blood drive on February 1st, 2025, or not February, December 1st, 2025. And that was our main winter weather in 2025, at least in the fall. And so we had to cancel. So Cheyenne and I went and volunteered so she could get some experience with what a Red Cross blood drive would look like. We had our first blood drive on March 3rd. And we had a really successful blood drive. They typically like to get about 15 units in their first blood drive. There's usually 25 slots opened up. We ended up getting 28 units of blood.
Oh, awesome.
So they thought we did a fantastic job. The next blood drive is going to be on, is it June 2nd, Taylor?
Yes.
And they I think moved us up to 30. They moved our target a little bit. It's going to be 32 units, I think. So that was great. First time showing. I may have mentioned it to the board, but I started into kind of a networking club for business leaders in the Kansas City Northland back in the fall. It's called the North Kansas City Breakfast Club. It's an invite only networking club. And approximately every 12 to 18 months, every member gives what they call a craft talk. So I gave mine Can you turn the camera back on, Taylor?
I think I unplugged it. The wheel ran over.
Okay.
Or is it here?
Wheels of my chair rolled over it.
You all hear me though?
I can hear you.
I can hear you, but
Technical difficulties.
I don't know
Wheels.
if it Andrew, I don't know if it mattered, but back there you said 3,026. Was that 2026 on March 3rd?
I went way into the future, Susan.
Okay, you've already seen that. Okay.
Was it written wrong or did I say it
Yeah,
wrong?
on just on the agenda thing. You'll see that March 3rd, it says 3,026 instead of 2026.
But anyway, at the um, Breakfast Club, one of the things that happens after the crap talk is everyone comes to the person's business and signs the book and visits the person's place of business.
Oh,
So we had about 55 people from this business club come to the health department, get to see the health department, and Cindy Cogan actually had the book at her desk, and so got to talk to a lot of the people, and it was interesting. I didn't talk to them, but a lot of the feedback was, oh, we thought this was going to be the most boring presentation ever talking about public health. And it was just such a great presentation. We learned a lot about public health. And so that was pretty great praise to hear that they were interested about public health and hearing about what's going on in Platte County. And then they were all impressed by the building and getting that many business leaders up here to see it. That was a great, great thing to hear. So the next thing was our budget overview at the end of February, which is 16.7% of the year. We were at $2,651,417, or 63.4% of our budget for revenue, and our expenses were at 15.2%. So we're right on track. Our money market account was at $2,619,803. Our lease purchase debt obligation is at $2,074,246. Still at that 2.88% interest rate. As we look at our customer service survey report, did pretty good with our number of surveys, 25 surveys, and we can go ahead and skip down to kind of the meat of it. How would you rate our service? We had 1 4-star response, 24 5 stars. How easy was it to use our services? 25 people ranked us at 5 stars. And how friendly and helpful was the staff? 24 5 stars and 1 4-star. So my favorite part is the comments. What did you like? No one really got called out, singled out this time, but again, lots of good stuff. What did you like about your visit? Everything. Staff was friendly, easy, and efficient. Getting my birth certificate, how friendly everybody is. Everything's so fast and efficient, very friendly staff. I mean, and I'm sure the rest of the leadership team feels the same way, but when you read this stuff, what else could you want? What can we do to improve? NA, nothing, everything is okay, not available. Candy, but I'm sure if we provided candies, someone would want healthy food choices. So Um, you know, but pretty much everything that you want to hear. So that's my report. Any questions?
Hearing none. It was a great report. It read real well online in the packet.
Perfect.
All right,
Taylor?
so we'll move on. Deputy Director.
All right, I'll let Rebecca talk about accreditation stuff, but you might have noticed, we did do kind of a letterhead refresh. So we have lots of different types of letterhead options. So as you can see, we have the one with Platte County Health Department right across the top, kind of a sleek, simple, design. And then when we get to the memos, you'll notice that they're slightly different, with the words on top of each other and a little title. And we have a few different ones for agendas, board meetings, for various things that we do for our letterhead, one with our address and stuff on it. So that was one thing that we were working on this month, along with our annual report, which we'll get to that. One fun thing I did in February was I went with some of our environmental public health specialists and I went on a final septic inspection. So that was kind of fun, getting out in the mud and getting dirty. It was a new system, so it wasn't as dirty. I thought it was going to be really dirty, but it ended up being not too bad. It's kind of cool to see Kyle and Rachel out there doing their job, and they notice little details, and I'm like, oh, it's great to see that they're, doing what they're supposed to do. That was cool to go with them on that. We also met with bylaws committee, which again we'll talk about in a little bit. Health Ed had a lot of events this month, as they usually do. So I think we had already mentioned that Rebecca and Trisha and I went to the Taste of the Northland event. So right now they're figuring out what is going to happen with the funds that were raised from that. One thing is there's a few organizations that are wanting to put together a food insecurity summit. So I think they're going to use some of the funds from that they raised at the Taste of the Northland to do a food insecurity summit in the fall. And then also they were talking about doing some micro grants for some of the food drives and food pantries around Platte County. Health Ed also did sleep hygiene presentations this month at the lead. And they did blood pressure checks at the YMCA. They usually have the CPR and first aid classes. So lots of stuff with that. The other thing is in the environmental report, Dr. Chaffee, you had asked last month about how to know if there was violations. So we added a section about total priority violations and the total food re-inspections. So, and then we did note there that the priority violations are the ones that kind of pose a stronger risk. And the reason that there's a lot more violations than re-inspections is because a lot of things can be corrected on site. So if they have a food that's out of temp, it can be corrected on site by throwing it away. Things that they can't do on site are like if they're missing their food handler's card, or if if they have something that's not, if their refrigerators not working, then they wouldn't be able to operate. So that's when we do those re-inspections. But our re-inspection numbers are pretty low. So there's 2 this month.
Thank you for doing that. It helped me as a board member. If I'm looking at this, how do I have a sense how the department's doing? Are there violations or they're not? So I did look for this in the packet. I appreciate it. Thank you.
Okay. Good.
I like that too. So thank you for thinking of that, Dr. Chaffee.
No, I just didn't. You're welcome.
Yeah, it makes more sense. Definitely.
All right. Well, any questions?
Any questions for Taylor?
No.
Hearing none, we'll go on to Dustin, clinic manager.
All right. So the biggest thing we did a lot of back to school clinic, school shots at Parkville School District. So we put up all their middle schools, high schools, and had record numbers for the turnout. We did a little chart. This school district actually has been tracking how many vaccines, how many students we've been giving the past few years. So total record this year, 217 students vaccinated, 488 vaccinations given, which I was impressed by that number because as we were going through, most kids in this age group, typically at middle school, get a lot of catch up for hepatitis A, but a lot of them are actually already vaccinated, which is pretty awesome to see. on our end. Yeah.
And on the vaccinations, as I read this, it jumped out to me that there must be some lead time to provide to parents to give consent
Mhm.
for the days you guys are gonna be there. And I was just wondering, that's a lot of work. And as I saw those numbers, I thought, I mean, the word lead is up in there too, but there was some lead time that you guys had to do so parents can get the convenience of that program. I was curious, how much lead time do you guys have? And
I was gonna bring this up because this is a
Oh,
huge
great.
undertaking for all of our
Thank you.
staff. So I got to shout out to Paige and her clerks and then for the nurses too, because there is a lot of work that goes into it, especially with that first one that Park Hill South High School had nearly 200 applications in for students who are wanting to be vaccinated. So what we do is in the fall, we'll kind of schedule with the school, find dates and times that work for it. We prepare letters that will have like links to each individual school so they can sign up that way and enroll. They'll send out letters, they do reminders. Park Hill, like I said, Park Hills High School South did like the biggest campaign. Like they had their nurses calling parents like almost every single day saying, "Hey, someone's wasn't enrolled in this program yet. Make sure you get your kids their school shots." So, and then we usually have cut off like 2 weeks prior to the actual event. That way, it gives our financial team time to kind of look through insurance, verify that. And it allows us time to actually go through and order vaccine and get extra if we need it. We try to do them around the same time each year. That way we can use like last year's trends to kind of get an idea of how much vaccine to have on hand at that time. So we're not trying to scramble and get it in last minute. But with that too, the nurses are, we're verifying those records, making sure these kids actually need these shots. Like I said, we found a lot of them already had the hepatitis A vaccine, so we didn't need to bring that as much with us and vaccinate them for that. Some parents will like check the wrong vaccine, or we'll see the kid needs like required meningitis vaccine. They sign up for the wrong meningitis vaccine, or they might sign up for one vaccine that they need and not the other one. So we're calling parents, trying to get verbal consent, documenting that. Meanwhile, Cindy and her team, like I said, they're going through all that insurance information and then packing it for the day of the event, going there. And I said, the Park Hill South High School was the biggest one. We had, like I said, 197 students came from that one, and, 94, with 192 vaccines given. We got all that done in like 3 hours, 3.5 hours, which was a pretty busy day for us. We were all a little exhausted, but we got it done. And like I said, very huge success this year with that. So with Emma on board now, we're trying to do some more things with this. One of our goals is trying to go into the fall, like October, November-ish, hitting some kids up then returning back into spring, and then trying to get them like those second doses, like for like HPV and the meningitis B vaccine and things like that.
have you considered it? Maybe you have during registration process. New registrations, they have to be there physically in person, and it's an opportunity to interact with the parents as they're planning the year. And online, they have to upload some documents to verify residency and things like that. But there's an annual interaction between the parents and the school district. I'm wondering, is there some efficiencies you might get by attempting to have the school district work with you to have that to be a platform that says, are you interested in getting an email or communication about vaccine availability on site?
So maybe we discussed, the school has asked us in the past if we'd come out during their registration days and like provide vaccines on site. That's very difficult to us because everyone in the county is trying to come here in August and get their kids their vaccine. So being able to justify that for like just one school, not really, that's not public health.
And I will say that mainly, if I can add in, mainly the parents come that are freshmen, and the kids do their own registration a lot of times the sophomore, junior, and senior years. We have very few parents that come on those. We have the most parents for freshmen, so.
Yeah, I'll look more opting in for parents having.
Oh, sure, just throwing out ideas.
But yeah, so no, like I said, this was a very successful year. A team did an amazing job with it. Emma jumped right in, got everything kind of helped and learned some things. So I know she's excited to like help build on some of those processes and like continue doing this and building it into like the fall.
And is this something that do you have the human resources to reach out to other schools in the county?
Oh, we are actually. So we'll be at Platte County R3 here in May. We'll be hitting up their middle schools and their high school on like all on the same day, just a whole day of doing their vaccines. Some of the smaller school districts we've gone to in the past and tried to reach out. Normally, when we try to get them though, it's only like 2, 3 kids who will sign up for it, so it's like really difficult for us to justify all that manpower and going out there and doing
Yeah,
that. So
absolutely.
it hasn't really been, it hasn't happened too much for those, but maybe if there's like a greater need in the future, that's something definitely we revisit and want to do.
It might be something that's worthwhile keeping documented, that attempts to reach the more rural parts of the county have been made. Because I think it's one of the things that we're all trying to do is make sure that the rural areas of the county aren't forgotten and left out, and that we're trying to be all encompassing with the whole county. So I like that, you've done that. But keeping it documented somewhere, if there's a question that's thrown up to one of us,
Yeah.
is, how are you guys, going out in more rural areas? Well, the vaccine outreach is there, but if you don't get enough response,
Mhm. And that's something I have Emma kind of working on too, is like developing like a, because we do a lot of offsite requests, so like revamping that process and the forms and making sure it's like when we go out to these site visits that they're ADA compliance, they have the space we need, we kind of have everything set up like, hey, here's what we need, here's our ideal setup, can you guys provide this? That way we kind of have that ready to go and make it easier for people to actually reach out to us, request things like say, hey, I have these employees, we want to do a flu clinic, make sure all of our employees are vaccinated for flu, and then make it easier for them to enroll and go through that process. So, but reports. Yeah, that's the bulk of it that we did a lot of this month. Again, we did the know your numbers for the blood pressure checks at the YMCA. We've been working a lot on their client participation. So WICHealth.org actually has like training modules for them, like for people enrolled in the program to kind of go through and learn more about nutrition program, how to use their cards, access healthy foods and things they need. They recently had a new document that actually has a QR code, so it makes it a lot easier for those participants to actually scan and like use the app and actually go through and learn the training modules. I have to look at the numbers, but I know it's been a huge increase compared to years past. They did get a little bit of feedback from Swope. Ironically, one of the in our customer satisfaction survey was actually someone who had Swope services. They also ranked all 5 on their review as well. So they only had one submission from this past month, but everything was all 5 stars on it. They like the team. They love Zara. She addresses her their issues, concerns, and gives them a little say in their input as well. Numbers are definitely up from what they were a year ago. They're getting closer to what our family healthcare numbers were. Not quite at that point yet, but again, we were operating a little bit more days a month than they were. Well, so and that's the bulk of my report. Unless you guys have any questions or anything.
What time do they usually start their clinic? What's their first visit time?
Usually 8 o'clock.
8 o'clock.
So
When do they?
Wednesdays and Thursdays 8, and they'll try to stay open till 5. I think their last one's around, I can't remember, it's 4:15 or 4:30, at around there.
do you have a sense of the number of our clients that are utilizing Swope Health before and after the transition?
I can
Roughly?
I can try to see if I can find that. I know, based on some conversations, just because like where a lot of our clientele were, they were closer to that Riverside area.
Yeah,
So a lot of them had kind of pivoted to that clinic since it's much easier access to them than coming all the way up here. But I can try to see if they have data they can see for
It's
that.
more of a self-assessment of the transition, and that if they do have some data on it, it might be reasonable at some point to look at before the transition. We have those volumes. I've seen them. And then after the transition, if they have a way to determine, I don't know, if we just have some basic numbers, say we looked at it, that's what I'm interested in.
Retention for
How do we know this was a good move? Well, yes, it's a lot less cost to the taxpayers, expansion of services. But did we lose folks? That's sort of one of those, are we looking at it saying, hey, was it good? I know less expensive, more services. Is it a long, I'm really interested in if it's a good long-term viability for them fiscally to continue doing that, because if it's not, we have to anticipate that they will pull out. So just something to think about down the road as we're moving through that stuff. I just throw that out as kind of how I'm thinking, just to share.
Yeah, I'll mention that at our next monthly meeting whenever set with them and see if they have any thoughts on that.
Yeah, it's just thoughts. I'm not asking a formal request here, just in brainstorming with the entire team here during the meeting, so. Let's go on to our accreditation QI assistant manager, unless anybody else has questions.
Do you have anything else?
I got that.
Okay.
He had said he's done.
Okay, I didn't, I missed. that.
That's okay. Thank you for keeping me straight and narrow.
All right, so we received our feedback on, I think it was February the 26th. We had 30 reopen measures, and just kind of for understanding, everyone else I've talked to who's doing initial, that's the lowest number I've heard. I'm not pulling people nationwide, but I do know different accreditation coordinators around the country, and people like, that's really good. So super kudos to the staff. Everyone gave, their best effort. With that, some of the measures have both examples open, some just one. So we're looking at 38 documents that we have to resubmit.
38,
38, yeah.
and that's out of,
Like 100, yeah, it's 100, was it 22 or 44 measures?
But each one has multiple examples.
Gotcha.
It's close to 3.
and the word reopened,
Right, so what that means is that
they want it revised?
yeah, they looked at it and they said either A, this example does not meet the need, or B, yes, you're close, but we need a couple more things to it, and they'll kind of list them out. And some of them are small, but all the way up to this isn't gonna cut it. You need to, redo the measure and come up with new examples. So Ed, I made a sheet for everyone to look at and kind of assigned initial people to look at them. And everybody looked at each other and was like, well, I have something for this, I have something for that. So everyone has pulled together because that's a very tight turnaround. So I really appreciate the staff working so hard. I actually had Dustin today take one that Health Ed had submitted. He thinks he has something better. So I appreciate everyone. So right now the count is of the 38 documents, we have 13 in review already. 2 of them uploaded, and 1 we talked to the coordinator and had her come around to our side that actually did meet the measure. So really it's 37. So that's all of that. Kind of heading down south of the board report, we're kind of focusing a lot on World Cup preparations with our partners. So we've started a World Cup committee at Health Department because different positions are on different kind of community meetings between technology, emergency response, and we're bringing all that information back and sharing with each other. Anything else?
Any questions?
All right.
I will jump in. If you scroll back up, you had listed policies because
Yep.
that's gonna be something that I'll bring up later. Was there anything on policies? Maybe I'll just bring it up when we go to our bylaws annual review. That's what I'll do. Okay.
Yeah, we are doing kind of a whole health department wide kind of revision of our policies and standardization, making sure they're literate and actually up to date. We haven't really met as much during this accreditation time, but I will say the policies we submitted for accreditation, I don't think any of them were reopened. So there is that, but that is an ongoing review process that we're working on. Yes,
And there's an official policy committee.
yes. Actually, you're looking at it.
Well, the reason I ask is that at another board in this county, we just had to revise and review all policies because the board is responsible ultimately at the other one for all policies.
Right.
I didn't know if there had been ever a comprehensive review and overview and approval of our policies, and that may be a topic for discussion down the road, and maybe
That's what we're doing right now, or at least the health department policies. There's board policies that are separate from the.
right,
sub-
operational policies,
Yeah.
the way we call it. We had board policies and management or operational policies. But all of the policies ultimately at some point in time need to be approved by the board.
So,
Thank you.
Dr. Chape, so that is not how we have ours set up.
Okay.
If you would like to change the bylaws to make it that way, we can do that. That is not my preference. And it will really get into the weeds.
No. It's, I'm thinking along the terms of ultimate authority and responsibility for policies. Obviously, if there are board policies, the board ought to review those and make sure that they approve those. But you have let's call it operational policies. And if we are not set up like that, that's fine. Actually, we had we are finalizing our board policies for another board, and we had to articulate that there's board policies that had to get ironed out, which is the only reason it brought it up to me. And when we had discussions about the public comments policy, so I guess board policies, we may need to have a discussion about when we hit bylaws. So thank you for the clarification, Andrew.
Like the, and I'm going to actually say it because you had brought up one. Can you not move past that? Whoever's moving it. Because you'd actually brought up the policy regarding the public comments at meetings. And I had read that. And that's actually one that we'll have a draft for the board for consideration for next month. Because when I read that, that is actually one we should have. And it should be in the new board policy format. But that is truly a board policy. So there are board policies versus, and this is part of the discussion that we've had with staff. And I think Taylor and maybe Rebecca and I had this discussion like last week. There's policies that reflect the, that are really board policies. And then there's policies that are for staff. And I think we were actually having a spirited discussion about one such policy. I don't remember exactly what it was, and they may remember, but that does come up from time to time. But as far as your one that you brought up, we will, the more I read, I did not remember exactly how it was written, Dr. Chaffee, but that is one we will draft a new version for the board's consideration for next month. You're right. It needs some updating, but there is a difference between how we look at these different policies for the board and what we have for the staff are mainly their policies and procedures. They get down into the pretty nitty gritty about day-to-day operations.
Yeah, I think that at some point we can maybe put together a working group to assess the board policies and make sure they get reviewed. And I'll make that suggestion to Dr. Kingsley for an agenda item down the road. Statutorily or legally, maybe it's also wise to make sure that we're meeting the statutory requirements of board policies, policies and procedures, whose authoritative approval is required, how that's structured, set up. There are standards of how that's handled for most public boards. So I wasn't sure at some point we might need to take a look at that, but we've got other fish to fry in the meantime. But again, I'm not trying to make more work for everybody, but you know, as we
And
clean
just
things
so you
up,
know, we did that with Jen. We met with Jen before we did this. So
right.
she
I was just
signed off
making
on
sure.
how it's set up and she blessed how we were doing this.
Thank you. That's really what I was asking. Thank you for reading between the words. Okay. Should we move on to any finance committee and subcommittee reports? Susan, you got anything on finance?
I guess that's me. Yes, we met back on March 10th on Tuesday, and we still are in the discussion. We had heavy discussion about the merchant services. That's with Central Bank. Right now, we're trying to get it transferred over to Nottaway Bank. And there's still some, a lot of issues, some more investigation on what type of the machine that we're wanting. Andrew, do you want to add more to that?
I don't think so. I think there was some miscommunication between what we understood and what Nottaway was telling us. So I don't think it's worth even muddying the waters. We're still trying to figure out where we're going, but our current credit card machines are still working, although they're just not currently supported. But as long as the machines are working, we're okay. But we need to get new ones that will have all the support. they're not compromised or anything, but we do need to get new ones at some point in the near future.
So the discussion still continues with that. And we also had a discussion on moving from debit cards to credit cards for the employees. And we've kind of left that in terms of the supervisors to decide who would get the credit cards. If someone's purchasing something frequently, they probably need a credit card. We can get rewards from that. Maybe it isn't a whole lot of money, but it may help with purchasing a few things. So that's what we decided to go with there. And do you want to add to
Susan, I
that?
guess I will. Yeah, I will add a little bit to that. In the past, we hit, and probably for years, and Cindy, if you want to add in, but for years, the director had had a debit card, and anytime a credit or debit card was needed, everyone pretty much used the director's credit or debit card. The issue with that is the accountability is not really great because you could have nearly anybody in the department using that debit card. And we are moving towards whoever is making a purchase actually having a credit card with their name on it. They still have
It's,
to have the receipts. They still have all the accountability. It will just have their name on that credit card. It will not be a personal credit check. It will still be the health department's credit. It will, you know, but any rewards and will go back to the health department. So we'll be seeing probably hundreds, not thousands of dollars of cashback rewards a year, but it will be a lot better accountability. Previously, what would happen is if someone forgot to print off the receipt and tell finance might have to go try to hunt someone down based on what it was. Now we will know because it will be associated with someone's card. There will be a little bit more work and that there will be more statements to reconcile. But every place I've worked, it's always been more geared towards, someone's individual name being on it. So there's better accountability and a better audit trail.
I think a couple people were still going to have debit cards, right? The supervisors?
It'll be just Taylor and I, just in those rare instances, should someone have to get cash or someone have to do something that only accepted debit, but everyone else will have credit cards
Credit. Okay.
only.
Susan, if I can ask real quick, did you guys have any discussions about when to use a credit card, especially in the face of potential additional 1 or 2% fees that some vendors are passing on? I imagine that had to come up.
Yeah,
I'm
and
gonna go to Andrew with that. I don't think
That's a
we
great
discussed
point.
that.
well, we kind of had that discussion offline, so we can do debits and other things. So we will use whichever mechanism of payment that is cheapest. We can still do, we have a lot of very thrift, and Cindy may want to expand on that, but we will do direct payments and checks or whatever is always the cheapest way of payment. And that's another reason to have the debit card, because sometimes that will be the cheapest too. But our folks are, especially our folks in the finance division, are always looking for the cheapest way of payment. But good point, Dr. Chaffee.
It makes
Thank you.
good to be in the minutes that it was brought up. I know you guys are awesome at what you do, but it just as long as it's getting addressed.
Yeah.
Susan, I'm sorry I
Thank you.
interrupted you. On with your
No,
report.
you're fine. And I think that was about it. It was a long discussion on both of those.
Yeah. Go figure. Any questions for Susan? Any other committee reports? I don't think we had any other committees active. I think we're
We met, bylaws met briefly,
right.
and
That
there
was-
were no significant recommended changes. That was the 26th of February. So,
I think the only change to the bylaws was really just the
heading,
header.
Headers,
logo,
yeah.
And then the little box at the top, and then at the very end, we added a section, so if we only review it and we don't revise it, that we can just have Kim, you can just sign it as secretary.
okay.
But we would change the revised date if we do revise it.
Um,
At the very end.
why don't we stick to the agenda real quick, and then we'll hit the new business, financial report. Didn't you, Andrew, you kind of already went through that, so we can go to the next, how about review and approve the bills?
I move that we pay the bills.
Second.
All right, any further discussion? Hearing none, I'll move to roll call vote. We'll go with Susan,
Yes,
Kim,
Yes.
Michael is yes, Zach,
Yes.
and so we will pay the bills. All right, fee resolution amendment. Can we scroll down so,
Do we have any
oh, no, no fee resolutions? Okay. I used to say, I didn't see them. Let's have a brief discussion on the NPR insurance rates. I think in summary, it's a 3% increase in the health department's contribution to the employees. Curious how this came up.
They review annually.
Okay.
What this does. At the end of the year versus the new year, they review the previous year's, insurance and its benefit plans.
Right.
And then they, also look at the dollars and cents of it all, make any adjustments to any of the plans that they need, or think, that are needed. And then determine whether or not there's gonna be a cost associated with any of those changes or just, the cost of doing business. And then they had a board meeting in February. Midwest had their board meeting and they voted to apply a 3% increase to the medical insurance. The delta of the vision and dental did not receive any increase, so 3%.
And that's a total of 3% for the premium, and how the premiums are paid differ amongst employees as to how much they're taking out, what their plans are. Is that right? So that applies to them. So is the health department covering the entire increase, or is it shared based upon the structure of their benefit plan?
So it covers in today's, right now the board is contributing $680 to a plan. That covers one person's high deductible plan for themselves for a single plan. So that's how that works. So the 3% just goes across. So basically it's $700 or $680 applied to whatever plan that they. And so there's a little bit extra, so some of them can put it towards the dental or vision. Also.
But this increase of 3%, which essentially is a inflationary adjustment, is not just being solely paid for by the health department, or shouldered by the health department. Okay, as long as that's just for the record, right? Any discussion on this? Does anybody have any issues with it?
So the benefit would go, the contribution on the board's part would go up to $700.
The $20
$20, yeah.
increase.
Up to, yeah,
per-
yes. The increase would be $20.
Okay. Anybody have any further discussion on it? Anybody have any reservations we need to discuss? Hearing none, I'll move to approve the 3% increase in the employer health insurance contribution for the 26-27 plan year.
I'll second.
Any further discussion?
Sorry, I'm just slow math in my head here. Is that not covering the 3% increase? The $20?
The, our
Is that not
our
covering?
portion of it, I think, is what is being communicated. It's going from 680 to 700, but it's
Yeah.
not a 3% directly. It's a total 3% in the premium,
Mhm.
of which we currently contribute 680, and we're gonna expand that to 700. I don't think that's a 3%, $20. It's not.
30%.
That'd be about that.
80 is about 25.
Yeah. that'd be
Yeah,
about that.
yeah.
So that worked.
I was like,
All right,
math
we'll do
there.
a roll call vote, if there's no objection to proceeding. Good. Susan,
Yes,
Kim,
Yes.
Michael is yes. That,
Zach, yes.
Thank you.
you're welcome. We had to have those things on the record though,
Yeah, no,
making sure we're
staff appreciate it.
doing our job.
I realized last time we told you guys about the contract to award amount for the accreditation systems funding, but I realized we did not. There's a motion to authorize director to sign the contract to start it. So request authorization for the director to sign the accreditation assistance contract with the Missouri Department of Health and Senior Services. The period of December 1st, 2025 through November 30th, 2026. This contract supports the Public Health Accreditation Board initial accreditation efforts at the Platte County Health Department. They're partially funding 7 positions and covering the cost of the FAD yearly fee of $8,400. During this time frame, we will be working on submitting, I don't know if I've ever.
You don't need to read it.
Oh, okay. Does anyone have any questions? And below is the recommended board motion to enact this contract.
No question, but good job.
Okay. So
I move to authorize the director to sign the accreditation assistance contract with Missouri Department of Health and Senior Services.
I'll second. Real quick question, is that really $8,400 a year it costs the citizens of Black County to be an accredited health department to an independent agency like FAB? Is that right?
that is
Currently, we have a contract that's covering
Right.
it, yeah.
But they're charging I'm just curious, is there,
It's
any
based on
sense or-
population size.
is it, okay,
So it goes up the bigger your population is. I think we're at the second level, having over 100,000 residents.
all right, if there's no further discussion, I'll do a roll call vote on this. Susan,
yes,
Kim,
Yes.
Michael's yes, Zach,
Zach, yes.
motion passes. The annual report is the next item. Oh wait, do you have more?
I think the
The
bylaws is reviewed. Yeah.
Oh, yeah, I skipped over that, didn't I? All right, all right, I did review all the bylaws today. Has everybody had a chance to look at it? Anybody want to discuss anything from the bylaws? All right, the only thing I had was to make sure we bring up that we'll at some point tackle the policies, but that'll be for next month's meeting. So I think we need to go ahead and do we need a motion to approve the bylaws as being revised?
Yes, I don't think it's in here, but
I move to like approve the reviewed bylaws.
Okay, so the bylaws, you're moving to approve that we have reviewed and updated the bylaws. I'll second that. I'll just move to roll call vote on this. Susan,
yes,
Kim,
Yes.
Michael's yes, Zach,
Yes.
great. More of a clerical item, but we gotta go through the motions on it. All right, the annual report, everybody got a chance to review it. I thought it was great. Is somebody gonna want to present it, or do we need to even present it, or just briefly go over it?
I can just briefly go over it. So this is our annual 2025 report. So the cover is the Awala
water
water bottle.
bottles.
And that was just a cute picture from one of the events that Health Ed did.
Kids still stop. Here's a water bottle lady. Yeah.
So you're famous.
Yeah, I'm famous.
Yeah, so I mean, we have the section dedicated towards Dan, and his retirement. And then we kind of talked about our plan, that we worked on. So last year we got a lot of plans done. So, some of these are also our goals and a part of our performance management system. So that's why there's the goals and objectives, in there. So, I think that we've already gone over the strategic plan, so we just hit some highlights from that. And then also our workforce development plan and quality improvement plan. So And then we highlighted the customer satisfaction survey. And then just all of our numbers for the year. And then other just big events, awards, things that we've won. I think we probably brought up a lot of these things already. But yeah, are there
During the
any
year.
questions?
Mhm.
The annual report?
Any questions on the annual report? Did you hear that, Susan?
Yes,
I don't think there's any questions.
looks great.
Looks-
I just
Yep.
saw the 1990 census was 57,867.
Isn't that crazy?
Like,
I don't know. Andrew came up with that number, so I don't know if it's.
I
Yeah.
didn't come up with it. I didn't just dream it up.
he's up in 1990, he's up counting households. He did his own census.
Random favorite number.
I'm not arguing with you, I'm just,
So I think we do need
Certainly
a motion.
Platte County has, certainly in the time Dan was here, Platte County had changed a lot and the health department had evolved a ton during his tenure here. And, you know, someone might think, oh, Andrew has too much of a bromance with Dan based on what the annual report said. But, you know, the health department was formed, I believe, in 1953, and Dan was here 34 years of that time, from 53 to present. And he just has had such an impact on, he's probably one of the longest, if not the longest tenured employee, and just had so much of an impact. And so many of our staff were either hired by them or mentored by him. And I just wanted to make sure he was recognized for his contribution. So, but the evolution of the department also during the time he was here, quite noteworthy.
Andrew, or anybody who knows, do we need to approve the annual report? I don't think so. We do
You do.
officially
You
have
do.
to. Okay.
So it's actually in state statute that the board has to produce an annual report. And the page talking about the finances is actually one of the most important parts. But yes, you do have to accept and approve the annual report.
It'd be, what might be good going down the road too, is a lot of these requirements, making sure that when we do a board policy deep dive, that all of the responsibilities of the board and actions might be good to be listed there. So, you know, take a quick look at it, because off the top of my head, I didn't know this. So, all right. I'd entertain a motion to approve the annual report for 2025.
Yeah, I move to approve, accept and approve the 2025 annual report.
Second.
second,
All right, any further discussion? Hearing none, roll call vote. I'll go ahead and go with Susan.
Yes,
Kim?
yes.
Michael's yes. Zach?
Yes.
Any other business items?
I think anyone's online, so probably no public comments.
So,
Okay,
so
there was one addition
Okay,
to the agenda, if you don't mind. We added it. I think there's a piece of paper in front of you.
That's all.
and I'm sorry, we should have asked if
When
we
we
could
add,
add it. But can we add something?
you're gonna get me over the 60-minute mark, and I was sitting there trying to put a notch in my lipstick. Meeting under an hour, but yes, please go on. Unanimous consent to address this? All right, well, let's proceed.
So a couple things. One is I was invited, well, actually applied to be part of the Missouri LPHA collaborative work group. I think there's 10 or 11 health departments across the state who have been asked to help the state health department work on foundational public health services. So I kind of got asked, but we also got kind of begged to help because they weren't getting a lot of volunteers. But after we got such a welcoming response to our accreditation assistance grant, I told Taylor no good deed goes unpunished. So we kind of were obliged to help them out. So I think my next 3 weeks or something like that, I have to go to Jeff City 3 weeks in a row. But the Wednesday night before one of those Thursday meetings, I got invited to Councilwoman Rihanna Park Shaw. She is having some kind of panel discussion, and she's had a few of these, but I got invited, and I did tell her I had to decline because I had this meeting the next morning fairly early. I just wanted the board to know that I had declined that meeting in case it comes up.
And I want to point out in this document that Andrew provided to us all, how late he stays up and works. He sent his reply at 11:46 PM. Burning some midnight oil, are you?
Oh, yeah, I mean,
While on vacation.
Yeah,
too.
Oh,
do we need to, I don't think there's an action item here, is there? Okay.
I just wanted you to be aware of it in case anything is said. You know, I have competing priorities, and I didn't feel like it would be fair to send Taylor because they didn't really tell me what it might be about, and it could be about anything. And I kind of feel like it should be me if someone's going, and I just can't be. I have other obligations, and it was 2 weeks notice,
Well,
and I
especially
already
like,
had something else.
like not a great, amount of information on exactly what
What you're-
policies you're gonna be talking about, live polling. That could get very hairy very quickly.
Any other items? Any informational items? I would entertain a motion to adjourn the meeting.
Move to adjourn the meeting.
I'll second. Roll call vote, Susan,
Yes?
Kim,
yes.
Michael, Zach.
Yes.
Oh, great.
Since we started at 6:03, we are adjourned at 7:01.
Next meeting is at April 16th at 6 PM.
Yep.
Same place.
Bring a birthday cake.
That's your birthday?
Yeah.
Oh, happy birthday.
Attend remotely and a cold beverage and a funny hat.
Oh, I'll just probably be here.